Hi, I'm Dr. Sridhar. You might have reviewed the earlier video I made on feed pattern in a breastfeeding baby. Suppose your baby needs any formula supplement for any reason. I have made a separate video on supporting breastfeeding when your baby needs formula feeds. It's most important that we continue to stimulate breastfeeding. If the baby needs formula supplement for a temporary factor like hypoglycemia in the newborn period or poor weight gain or jaundice, remember that it's purely at that stage that you need, so you need to continue emptying your breast, you need to continue to breastfeed and come off the formula at the earliest possible. Don't get into the habit of thinking your baby needs more milk and encourage the breastfeeding. Come off the formula. That's most important, because once you get used to some formula feed, you may start feeling that the breast milk is not enough. The growth pattern assessment I'll explain in a separate video as well, but don't be focusing too much on the growth when you're trying to come off the formula milk. Once the formula milk is stopped, your milk will automatically catch up with the baby's needs, and the baby's growth will catch up as well. So don't be over concerned about the milk output and the volume. Come off the formula and automatically your milk will increase. So this is for those who need for the short term. There are some situations where the mother is unable to produce milk. This is like 5 to 10% of the mother's maximum that you need to do mixed feeding. There is genuinely low milk output, and some mothers may choose to give formula feed for various reasons. They may have breast concerns, or they may have one side of the breast removed for cancer or something, and they don't have option to continue to fully breastfeed. The same applies to multiple pregnancies as well. There are many mothers who breastfeed twins exclusively, but more than twins you may need some formula supplement. A working mother, she can try to express store the milk and manage, but sometimes occasional feed she may need formula. So hopefully in the vast majority you need maximum 1 or 2 formula feeds top up a day. Remember that you can use your own express milk as a top up if you do need to bottle feed a couple of times when you're at work, and this is a better option because 1, the baby doesn't get used to the taste of the formula milk, and 2, your milk is being stimulated by expressing and emptying, so the production keeps pace with what the baby needs. So consider using your own milk for an occasional day out where you want to take milk in a bottle. Don't use formula unless it's essential. So the quantity of milk that a baby needs, again, if you are mainly breastfeeding, don't give an unduly high volume of formula because you don't want to train the baby to take more milk. The baby had got used to say 60 or 90 ml from breast milk. If you give 120 a couple of times, the baby starts getting restless after that 60 or 90 feed from the breast. That doesn't mean the 60 or 90 ml from the milk from the breast is not enough. It just means the baby is not satisfied because they're exposed to something else. So if you are mainly breastfeeding, don't give much formula. Use express milk and give 60 to 90 ml in the first 2 months because you would be breastfeeding anyway. If you are giving a bottle top up at night, you can give 90 to 120 ml after the first month up to 3 months. If you are mainly on formula feeds, you can give in the first couple of weeks 60 ml, and if the baby doesn't complete, don't force them. I told you that it needs time for the lactase enzyme to upregulate. You don't want to aggravate colic by overfeeding the baby. The only difference between 60 and 90 ml will be the frequency. The baby may demand 2.5 hourly if you give 60, while if you give 90, they may sleep 3.5 to 4 hours. But in the first 2-3 weeks, it's a disadvantage to give more than what the baby can take. After the first 2 weeks, you can move to 90 ml every 3 to 4 hours. And every month you can increase 30 ml. I have frequently mentioned before, don't follow the instructions on the tin, mainly because they aim the bigger babies who finish more. The normal average sized Indian babies don't need more than 60 to 90 in the first 1 to 2 months, 120 by 3 months, and 150 to 180 by 4 to 5 months. It's very rarely that you need to exceed 180 ml in a formula fed baby. By that time you may start weaning by 6 months, and you can start keeping the same volume or go up to 220 maximum. The tins often say 240, which I feel is too much for any baby, and getting the baby to feed more than what they need is obviously going to create a habit, and given the worry of obesity, you don't want to give excessive volume. The other factor to remember is that the stage 2 milks also have a high amount of protein. In breastfeeding, the protein keeps dropping as the baby gets bigger, but in formula feeding, the protein maintains or goes higher. So if you keep a very high volume of milk as the baby gets older, it's not ideal for the baby's growth pattern, and you may induce obesity. So once you start weaning, cut down on the milk to 3 feeds and give the rest as solids. By 1 to 1.5 years, 2 milk feeds a day is enough. And if you are breastfeeding as well, frequency of breastfeeding can reduce as the baby gets older, because frequent feeding is not good for the dental development and there increases the risk of caries. So I'll discuss the dental care separately. There are already videos on the channel as well you can refer to. So Two things. One is, don't focus too much on the growth pattern. Obviously, a baby may be 4 kilos at birth due to maternal factors like gestational diabetes, but the actual centile may drop down to, say, the 50th centile after the first month. So then your target becomes a 50th centile, so you're not going to aim for the 80th or 90th centile that the baby was at birth in these situations. There may be babies who are 2.5 kilos at birth who are growth restricted and they continue to maintain the 10th centile or 25th centile. That's absolutely fine. You don't need to push them to catch up, because catch up happens naturally in certain babies. You don't need to force the catch up growth because there is enough evidence to show that forced catch up growth is not good for the baby. Also, all parents should understand how to plot their baby's growth on a growth chart, understand what centile is appropriate for the baby, so they don't intentionally push the baby to take more. The colic phase is one stage where parents often are pushed to feed frequently. That's absolutely the wrong advice. If you feed more often, the lactose load increases, the reflux risk increases, and the colic and reflux going to worsen. So spacing the feeds better is one option. You can refer my video on use of pacifier. We don't normally encourage pacifiers in breastfeeding babies, at least for the first 3 to 4 weeks. If you can avoid the pacifier, overall it's better, but if you do need it to space the feeds by 2 to 3 weeks of age, you can start using it. Use it only to space the feeds, not as a routine habit. I hope this is useful. Please share.